Okay. PowerPoint. All right, how do we start this?
Yeah, just grab here. What is happening? There's a video.
I have no idea. Here, no, that's his presentation. Use your PowerPoint. Let's go. Here. Kill this one. This is it.
All right. Okay. All right. So one of the next things we had wanted to knock out is upgrading the website, right? We talked about how many communities are around us, how difficult it is to find us. And one of the things that we're going to want to do is to make ourselves found in places like Riverview, Valrico, and Brandon, and all of the places that we're located, right? So in order to do that, we have to update our website. My wife and I have committed to donating to fund all of that. I just want to let you know we set that up today so that we will have the funding that was promised the last time that we voted to approve, which will allow us to upgrade the security of the site, to incorporate the shop, which will allow us to receive donations to give the t-shirts and have that automatically fulfilled. And most importantly, allow us to increase the ability to recruit new members. Because we are going to be probably the only organization in Hillsborough that can actually get found, because we will be able to actually do real search engine optimization that gets us found for what people are actually looking for. Okay. All right. Meeting room. Obviously, you can tell we are approaching max capacity for the meeting room. As we start recruiting more people, that's only going to get tighter. The Brandon Library does not have much more room for us, so I have been reaching out, trying to find alternative locations for where we might be able to meet. We have an option from a local union. The union hall down in Riverview, the Painters Union, has I've gone and toured their facility. I am waiting for confirmation back, which I should have no later than tomorrow, that we could start hosting our meetings there, potentially even for free. Now, this meeting space is located right on 301 in Riverview, so it would be a little bit south of here, but like for Mary, there we go. I know Mary's excited. So this will be
almost next door.
And so this is only maybe 15 minutes from here, so it should be a relatively easy get to. And what is interesting for this one, we would have the building that we can use for our regular meetings with air conditioned. It's got everything we need electronically to be able to present and show all of that. But just as importantly is all of this open space. They actually have this giant open area where we then could host events, picnics, barbecues, all kinds of stuff to start engaging the community, which is right in line with the new strategy and mission that we're trying to implement. So here's the question though. This is not in Brandon, this would be in Riverview. If this organization were to host meetings in Riverview, is that something that we would like as an organization, or do you want me to only limit myself to Brandon for locations? What do you guys think?
It's not a brand new group. It's East Hillsborough.
It's East Hillsborough.
Yeah.
Everything is open.
I'm open to this.
Open to it.
I think we gotta go with what's best for us
Okay,
as
perfect.
an organization.
Something like this where we can host up to 100 or more people and potentially for free.
And it's free.
And it is about as good as you can get. I will tell you, obviously, we'll have to deal with 301 traffic. We're trying to do a meeting at like 6:30, so get ready for some headaches. But we should still be able to do everything we want. So if we get that approval from this union, this week, then that's something that I'm hoping to, move us along to. Community service. Michael, who volunteered for community service, chair last week or last month, unfortunately had a fall. He broke his arm and his hip. So he's been a little bit out of commission. He is hoping to maybe be able to join us at the picnic at the end of this month. If not, then he's really hoping to be at the next meeting. To fast track some of what we're doing with our community service, I have created this, which is based off of a Hope for Her resource book, which lists every not-for-profit in the East Hillsborough region. What they do to help, and it's broken down by categories. So we've got names, emails, phone numbers, organization names, behavioral health. And this will scroll down through all the different categories of help that we have. Budgeting, case management,
You got a Hispanic service?
yep, we got
Oh, yeah.
childcare, clothing, counseling, dental, credit counseling, domestic violence.
So these are all our options.
These are all options for our community service committee to start reaching out to. And what I talked to Michael about doing is having us coordinate with members of the community service committee to start reaching out to these organizations to find out a couple of things. Number one, do they have any events coming up where they need volunteers? Number two, what resources do they need for things like this? And this is actually for Mary is also a member of the Southeast Women's Democratic Club. The Southeast Women's Democratic Club is doing something very similar where they are reaching out to the community. So today, when I finished this spreadsheet, I actually shared this with their president, Liz Congrero, so that they don't have to duplicate the work, right? Because the point of this is for us to help get Democrats elected, not to keep the knowledge in-house in East Hillsborough. It's to make sure we're helping as much as we can. So this was shared with Liz. She shared something interesting with me. Their committee on community service has already started reaching out to some organizations. They didn't have a spreadsheet like this, but they've gotten so many opportunities. They have almost 2 things scheduled a month for like the next 6 months, where they've got opportunities to go volunteer. They've got people coming in and doing things, so they've got a lot of options for that. So I'm confident that we will have lots of opportunities too. And Liz has said that she'd be happy to let us come meet with their community service committee to see what they're doing that's so successful, right? And I think that's a good big first step for us as a group to reach out and start allying with other clubs just like us that are trying to do this same work so that we can keep moving this ball forward. Okay, and obviously you can see this has everything, all the way down to vision. Go ahead. Yeah, I'm gonna share this with everybody, so that we can all have access to one of these, and then we'll have one kind of like master list in the background, just so things don't get accidentally deleted. So, all right. All right, let's talk about the picnic. Chris, do we have anything that you need from us for the picnic? Chris Rimmett?
Dang it,
20.
dang it. Are you gonna go there early and get the shelter?
I will.
And then we're gonna need a vote on spending like $425
Okay,
for food.
motion to spend $425 for food for the picnic. We have a second?
Second.
Second? Any opposed? All in favor?
Aye.
425.
425.
Are we gonna be able to make that?
Do we need to bring anything, Chris? What do we need to do? This might work back for the picnic.
Anybody who
If you want to
wants,
come up here and just tell us a little bit about anything that we might need?
Nobody bring the side.
to all those who have gone in the past, we've been doing it for God knows how long.
Yeah.
It's at the Paul Sanders Park, Kings and Bloomingdale. And we try to get the tent closest to the bathroom. It's also got more shade so that our cook back there, Emmett, doesn't get boiled in the sun.
Appreciate that.
So that's,
To bring side dishes?
anybody who wishes can bring a side dish, dessert, anything you want, try not to have everybody bring coleslaw. What will be available? We have hot dogs, hamburgers, and chicken, and soda and water. Alcohol is not limited, not allowed in the park, but we hope we don't see.
See, Emmett, you drink water, everybody?
Yeah.
Yeah. And if you wanna bring something to cook on the grill too, I mean, it's, very.
What's
May
the
31st, May
May
31st.
May
31st.
30th, it's the, last Saturday. of the
Last Saturday of the month, it's on 31st.
It's the 31st.
Okay. May 31st.
And it's
Time
from
like
11 to 3, if you wanna come earlier to help set it up,
Yeah.
around 9:30, 10,
Hey, Chef,
do that.
needing help?
I'm supplying
I'll be about
3 tables, 2
9:30 in the
big
morning?
ones and 1 card table. I suggest you might wanna bring chairs, it's, we usually have enough, but you never know. It depends, who shows up, we literally open up the whole community. We don't care what color, race, or political party you belong to, you're welcome to come. And,
We usually have candidates to come to a lot of. We have candidates.
who would not, we normally do some of this stuff at the board meeting, but he was sick.
I apologize, I was sick.
Mary
so
was
I'm
out of
sick.
town, Jack was out of town. And, Mike had fallen over there. So it was me, Walt, Catherine, me and Sue. But, I don't know if we need some coolers. I've got 2 coolers.
Okay.
We can get,
I'll bring 2 more.
I can bring,
I'll bring 3 chairs also.
okay.
Does anybody?
We've used 1 more long table. It's got one.
Pardon, John. Bring them.
Okay. Well, what will happen is we won't put one up.
Yeah.
But that way, if he trips over his cat, we still got one.
Coolers,
Chairs. What time get there in the morning?
so that's coolers, side dishes, chairs, and then the last thing, we want to invite our friends, right? One of the things that we are just getting restarted is trying to build this organization into having larger membership, right? We've already seen it grow substantially in the last couple months. One of the next things we can do is bring people to a social event like this, right? So let's each try to commit to bring at least 1 person. Just bring 1 extra person who's not normally in this room that might enjoy seeing what the Democrats are up to. Okay?
Do we have a flyer we can print out?
Hey, I've got to see if I will have the whole website access. So, first give me the website access. If we have it, I will try to get the shop set up so that we can start doing the stuff immediately. But I don't know a lot of shirts with it. I'm hoping. All right, one last thing before we transition to our speaker. Obviously, we are here because we want to see Democrats get elected, to start helping fix some of these problems, okay? Now, we're in pretty dire straits. I'm sorry, we got a thing popping up over the thing here, but we are here in Hillsborough County, as of today, down by over 17,000 registered Republicans. In Hillsborough County, a county that most people consider bright blue, at least in the city of Tampa, and potentially for the rest of the county. That clearly is not how elections have been going, and I will tell you, this shows us that this is not the way voter registration is going. We're not tilting towards a blue county right now. And here's the thing. DNC is not coming to save us. Nobody's coming to save us. It's on us. We're going to have to get people enrolled to vote. We're going to have to get the people who are already enrolled to show up. To that end, and I'm sorry that this is covering this up here, but it's this link, bit.ly/EHD phone bank 833. This is precinct 833 here in Brandon, where we have about 720 voters that we need to reach out to. This is a virtual phone bank, so you don't have to use your own personal phone number. You don't have to use any of your own personal information. What will happen if you scan that, it will take you to register for this vote by mail. You can call directly from your laptop to each of these people so that you're calling from a private number, not sharing what you're already doing, okay? And I will tell you, I did this with the Gabe Alamont campaign and the Josh Weil campaign. It's super easy. My wife and I would sit in the house and just make phone calls at the end of the day to help try and get voters to turn out. So this is a list of voters here in precinct 833. I picked that because that's the precinct I'm a captain of. What we're going to do is get a map of every single precinct that's out here. We don't have a lot of precinct captains in this area of Hillsborough, and so we're just gonna adopt a bunch of precincts and start trying to make sure that we get Democrats re-registered for vote by mail, which consistently is the best way to get our voters to turn out. When we did an analysis of people who voted in all 5 of the last elections in which Democrats could vote, almost everybody who was a super voter who voted in every single one, voted by mail at least once an hour. So we want to make sure that everybody who voted by mail re-registers. We will then ultimately transition after we move through some of these with Democrats to then trying to get NPAs to vote, and we're working on getting the data on people who are not registered at all. So we can make sure that we are reaching out to people to see what we can do to help get them to show up to the polls. Sound good?
Yeah.
All right, so that'll be our call to action. I apologize for, obviously being down sick for the last 2 weeks. I didn't get as much done in the last month as I hoped. So this is where we're at. Yes.
Are we gonna be registering new voters?
Yes, 100%. So this is to make sure that our existing voters turn out, but one of the next things that we will be doing is building these out, trying to register new voters and also to talk to brand new registered voters to make sure they know what to do and where to go and all that good stuff. So there are a lot of layers to that, right? So we have Democrats who are registered, who fall into one of 3 buckets. Vote all the time, vote sometimes, never vote. Those are the kind of people we'll see in that. There are NPAs who we would like to see turn out in support of some of the things that we've done because they've registered. Some that always vote, some that vote sometimes, some that never vote. That's kind of our second bucket of people that we want to make sure we're reaching out to. The third bucket is not Republicans. I think we've all experienced in our lives trying to convert a Republican, to convert someone with a red hat, come over and listen to what we're saying, not going real well, right? And so that's kind of a waste of our time in most scenarios. Not everyone, but in most scenarios. So our third most valuable target will be people who are not registered at all. Now, if we go back and take a look at this slide here, there are 792,000 people registered to vote. There are over 1.5 million people in Hillsborough. We have a lot of people that we can register to vote who are not registered yet. That is ultimately going to be something that's high value for us. But first, we got to shore up our support inside of our own team, right? We got to make sure that Democrats know, hey, they passed a law where you just got kicked off the vote by mail rolls. And if you want to do that again, you got to re-register and get them back out there. Then once we get our feet under us with that, then we start trying to expand the team. Does that make sense? Yeah. All right. So if you can take a shot of that, I'll also make sure that we share that out. I'll try to send out and add all of this information in it so that everybody can sign up.
Send it to me,
Send it to Chris,
sure everybody
get it out.
gets it.
Perfect.
Will you get notifications when these are being done?
Yeah, so this, so this will be tracked inside of, inside of the app for this, the voter registration app, and then I will also have a reference anytime this link is used or this QR code is used, it's
Okay.
also tracking that. We'll be able to move through that. There's about 720 names, which, if everybody in here just did, 10 in the next week and 10 in the next week, we'd be done. Right, so like, it's not like, it doesn't have to be a huge list, don't feel like you have to make 720 phone calls, I need you to make 10.
Yeah.
If you can make 10, we're gonna smoke this, right? And that will make us one of the only clubs that's actually doing this. There are not a lot of clubs and caucuses that are out there actually doing this. Southeast Hillsborough was one of the only ones out there actively registering voters.
We
They're
have
from the libraries, they're doing it all the time. So like, this is something where we're just moving in a different tech direction of saying, hey, let's just make this available to you from home at your convenience. Make 10 phone calls at some point in the next month, we'll be doing great, okay? All right, Stephan, want to talk? I hear something about healthcare. You can, kill the flood. Oh, so that goes to the people on Zoom. So yeah, so you'll have to project it here and also talk to a couple of people's ears out the speakers. Good luck.
Hello everyone, my name is Stephan Ramdohr. Chris asked me to come in, so it's wonderful to be here.
You gotta hold the mic. Does that work
Yep.
on this? Because this is on the web.
Yeah, that's all right. My toggle's running through the whole thing.
So, as I said, Chris asked me to come in here. My name is Stephan from Ramdohr. I'm like actually down in South Florida, and he kind of asked me to give a presentation together with Jody, Jody Cohen. So, yeah, you want to come along as well? Or? Okay. So, yes, it's about the issue of healthcare. That's the nonprofit organization that I'm with, which is Medicare for Florida. Was down in South Florida. I'm also just as a registered Democrat active in my club. So, for example, Cold Springs Portland Democratic Club, or we have the West Broward Democratic Club that is like this. And yeah, of course, myself just as a Democrat, I mean, it's so amazing to see a club like this being so active. You know, you have the phone banking coming up for like 5 a.m. all activity, like with the going on. My thing.
Hang on a second, I forgot. I gotta share the screen.
Yeah, so I'm still being set up in the meantime. Also want to just pass something around. We actually have on the issue of healthcare right now, a petition that's going on to get Medicaid expansion on the ballot. Here in Florida, it's 86 for Floridians to have a chance to vote on. So this would get more than 1 million Floridians who don't have health insurance right now. Health insurance. So it's something you might be familiar with this, but or not. So this is a petition form that will go to the state. More than 1 million signatures is the goal of Florida besides healthcare to be able to get this on the ballot. So if you haven't done it yet, consider deciding the petition, please like pass it along. And then in addition, we also have some Medicare for federal legislators. So my understanding of the great recommendation that Chris asked me to come in for together with Jody, of course. So Medicare for Florida, we're all volunteer nonprofit organization advocating for healthcare reform. So you can see that our board of directors, all of the people who volunteer their time and all volunteer organizations to help advance the cost of healthcare, to expand healthcare, to potentially get development of universal healthcare. Yeah, the vision is basically to try to educate the public as well as also engage elected officials on all levels of government for guaranteed healthcare for all. Specifically, there are these bills that actually would make universal healthcare reality. So at federal level, that's the Medicare for All Act. And then we also, as a volunteer nonprofit organization, actually wrote the language ourselves that we then asked state legislators to review. So, for example, we built that bills that we helped write the bill language for the Healthy Florida Act, of the healthcare, and it's a $35 a month copay cap for into. In addition, we're also working on city county resolution for Medicare for All as well as helping to fight back against the privatization of Medicare. So, yeah, what is it that motivates some of us to actually try to work on this issue of healthcare? So basically, the reality is that you have, unfortunately, more than 2.5 million in the state of Florida who are without health insurance, more than 7 million across the nation. People who, of course, are underinsured, but they have co-pay deductibles out of pocket, so why they can't use the insurance that they may have, and so there's these disparities even along the specific groups of the population. Some of these slides now are from an organization called Physicians for a National Health Program. So that's an organization that we partner with, consisting of more than 50,000 physicians all across the country, who also advocate for the expansion of healthcare with the eventual universal healthcare program. So, and what does it mean? So, what does it mean that people can receive the care they need that might have real consequences? With this slide about the research, basically have found out like, what is actually the human toll on, for example, people not being able to get the healthcare that you keep uninsured. And yeah, then of course, we also have to talk about the healthcare cost, right, way faster than, for example, inflation would. So, this year shows how, for example, the average deductible actually tripled, from 2006 to 2022, just for like a, individual insurance. And then unfortunately,
You got it.
we even have a situation where in this country there's, like obviously folks each year that actually have to go through bankruptcy. Most of them having like medical bankruptcies. And yeah, so that's sort of all bankrupt private medical bills or in this million is worth of that cause. So that's another reason why we get closer to that ultimate goal of universal health care to help prevent this. And even if we have insurance right now, I might think, oh, you know, I have insurance, like doesn't that protect me from something like that happening? Unfortunately, majority of folks that had to go through such a process actually did have insurance at the beginning of their illness. And going back to the cost, the reality is that actually in the United States, most peer nations pay by far suppose for health care per person per year. Yeah, incredible amount that the United States spends, despite at the same time not necessarily getting better health service outcomes. So for example, you shows when we spend all this additional money compared to all these other countries on healthcare that get us more care. No, actually, it doesn't, because, for example, the number of physician visits per person per year is like not higher than other countries. Same things go for like, say, inpatient hospital, the states and stuff like that. So, and yes, that unfortunately, even the health outcomes are better. They looks at life expectancy. The United States has lowest our peer countries, as well as other healthcare indicators such as maternal mortality or other ones that push the fall back. So you now have to open for this one. Okay, so
We just heard how we in the US spend more per person.
No, the remote.
Does that help?
So people online can hear you through the microphone.
Oh.
You're okay.
Okay, we just heard how the US spends more money per person on healthcare, and we don't receive better health outcomes. But where does this money go? Always the big question. Turns out more than 1/3 of it goes to administration. It's not specific to United Healthcare or other healthcare organizations. Go to the next one. It's not specific to United Healthcare or to other organizations, but it's very similar. Just as an example, our traditional Medicare program has an overhead expense of 2.3%, as opposed to United Healthcare that spends 18.5% of their money on administration. 1 out of every 5 healthcare dollars in the United States doesn't go into care at all. This administrative expense is bureaucracy, advertising, profits, and shareholder dividends, and excessive CEO policies. This is an illustration of our current fragmented healthcare system. So Medicare, with its quote advantage plans, and we, the people on the left, first pay all these insurance companies, and then those corporations pay our doctors, hospitals, and medications. Having these middlemen is very inefficient. Now we have hundreds of insurance corporations, plans, and payers. Physicians, hospitals, and patients have a lot to deal with. It's not specific to these particular hospitals. Other hospitals are similar, and is only an effect of our fragmented healthcare system. Our neighbors to the north in Canada have a program called Medicare, and it covers all. This means Canadian hospitals don't need an army of billers and clerks to figure out who is which insurance, what plan, what network, what payer, et cetera, like US hospitals. In another example, in Taiwan, they have a single payer plan, just like Canada. There is just one entity which pays for all care, just like Medicare for all would do. The share of money wasted on administrative costs is significantly lower compared to the fragmented system of the United States. This slide sums up beautifully why we need Medicare for all. It's like Medicare, but it's better.
Oh, I'm so sorry, I think that's coming up still. So,
I missed that. Okay, sorry.
I guess I need to get the mic again.
I said, this is my first time doing this.
You're doing great.
Stephan's the expert.
So, just to elaborate on what Jody kind of mentioned, when it comes to the fragmentation of the United States healthcare system, there's been something called advantage plans, which basically means that our Medicare program pays private health insurance corporations like a certain lump sum every year for some patients. At the same time, these advantage plans, these corporations specifically select healthier patients to cover. So they basically do what is called cherry picking and lemon dropping. So, and that kind of results in that they basically get overpaid. And so, there's several studies that have been calculating out that up to $40 billion a year is actually what we as a country overpay.
They're having a little trouble hearing you online, so you can just keep the mic up here.
So try my best. Thank you. So as I said, that's just another part of basically the fragmentation of the healthcare system that we're trying to fight back against. Is these advantage plans, which sometimes unfortunately make it very difficult for people to get care. Also, it's like cumbersome reauthorization processes, delays, and denials. So, fortunately, there is a bill that actually would make universal health care a reality in the United States. It's called the Medicare for All Act. And that bill is actually already co-sponsored by more than 100 House Democrats. And here's actually a picture of that bill rollout. That bill would improve the current Medicare program, the traditional Medicare, to cover all medical appropriate care, including all of the things that might not be included right now: dental, vision, medical equipment like hearing aids, mental health, prescription drugs, and much more. And then also over a series of years, basically this improved Medicare will be expanded to gradually lower the eligibility age over time, that eventually all US residents will be covered. And that would be like no co-pays, no deductibles, no out-of-pocket costs. So that would be like this is kind of improved traditional Medicare program, no financial barriers here. So yes, this is the bill, the Medicare for All Act, healthcare reality, and yeah, there's already more than 100 House Democrats, for example, who are sponsoring this. So, Julie, I'm going to give it back to you.
This slide sums up beautifully why we need Medicare for all. It's like Medicare, but better. Because Medicare for all would improve Medicare to include things not traditionally included in traditional Medicare, like dental, vision, medical equipment like hearing aids, mental health, prescription drugs, and more. No supplemental insurance would be necessary, and it would be a full coverage with no co-pays and no deductibles. And this improved Medicare program would then be expanded so that regardless of age, all US residents would be covered. Study after study shows that even when taking on the extra expense of providing full coverage and covering everyone, Medicare for all would still cost less than we currently spend on healthcare as a nation. Because a Medicare for all program would be so much more efficient. We've seen this slide before. This is an illustration of our current healthcare system. On the left, that's us, the people, but then it gets complicated because we have to give all our money to these insurance corporations who then in turn pay for doctors and hospitals. A lot of money gets lost as we have to deal with all these extra middlemen, the insurance corporations. I know there's problems with overbilling sometimes. My personal experience was recently I ended up with a hospital bill for over $41,000. They ended up paying the hospital $8,000, and I had a copay with that. In contrast, this is an illustration of why we could save so much more money with Medicare for all. Our improved Medicare program would just pay for all of our doctors, hospitals, and medications directly.
Thank you. So, yes, summing it up here by, addition for National Health Program, for example, they're putting it in these terms. 95% of households pay less in taxes for Medicare premiums than what they currently pay premiums for basic prescriptions. So, can we afford universal health care? Yes, we would, and we would also have full comprehensive dollar coverage. So, yeah, and even in addition to all of these studies that have been done on this to figure out to what extent it's feasible, there's even a 253 economists got together and wrote a letter that has been published, kind of calling for Medicare for all. Yeah, what is the public support for this poll? For example, this is from last year, an opinion poll, and you can see how even amongst Republicans, there's like net support. At the same time, then it increases even more for NPAs, and of course, for Democrats, it's a very high approval of this kind of idea of universal health care. So, and at the bottom here, there's some more of those headlines regarding the support. And now coming back to Medicare for All Florida, a nonprofit organization, all volunteer that I'm with. So yeah, this is what I do as a volunteer when I'm not volunteering with my local Democrats for the issue of healthcare here. We're fortunate to be able to put on all of these events. So for example, large virtual town hall events with like a panel of experts. We had like almost 150 people on Zoom or on Facebook Live, all of that. Yeah, we're fortunate to have, for example, the Congress people from Florida that support Medicare for all speak. So this is, for example, Frederick Wilson saying, for most Americans, the status quo is actually failing. That's why I'm proud to be an original co-sponsor of the Medicare for All Act. So from South Florida, Frederick Wilson, we were fortunate to have as part of our town hall where she made these remarks. Or of course, from the Orlando area, Maxwell Frost, kind of reiterating this support about why he's supporting Medicare for All, because it's popular with coverage from the top of your head to the bottom of your feet. So, and then even my personal congresswoman for my district where I live down in Broward County, Congresswoman McCormick, saying, I urge you to join me in my fight to make sure that we can all actually help with getting Medicare for All passed and implemented. And so now I see back to Joey.
These next slides show some of the activities that we healthcare advocates here in Florida with Medicare for All are doing. One of the many things that we do is to table at Earth Day and at Pride Fest, as well as other events, and to collect petition signatures to get Medicaid expansion on the ballot, which you have seen. In addition, we collect signatures for the for federal legislation. And we asked people to co-sponsor the Medicare for All Act. Here's some pictures of us tabling. For example, last year we had a table at Tampa Pride. And this year we were at the East West Music and Dance Festival in Tampa. Next month, we're going to be part of St. Pete Pride. That's on June the 28th. Also, we were fortunate to have a chance to support, Also, we were fortunate to have a chance to support some candidates like Gertie Remy, who supported the effort of the city of Altamont Springs to pass the Medicare for All resolution. And State Senator Carlos Guillermo Smith always supported Medicare and universal health, Medicare for All, and universal health care. And this year, bills were introduced that we had written. Task Force on Universal Health Care and the bill for $35 a month copay cap on insulin. We were very happy to have a chance to go door knocking with Carlos. And just today, members of Medicare for All Florida are out and about giving presentations about healthcare reform. For example, we also gave presentations for union groups like the National Association of Retired Federal Employees and for community groups like yourself, Central Florida Grassroots Progressive, and many others.
So, yeah, this is what I know you just mentioned. Is an overview of these bills that we as healthcare activists here in Florida actually like wrote the bill language for, and then reached out to some of our state legislators to ask them if they wanted to introduce these bills. So, and of course also, yeah, in case, for example, you have state legislators here in this area that you might be connected with, I'd love kind of your input on, for example, having even more state senators, state representatives co-sponsor these bills. So, yeah, we have these three bills that like Jody just mentioned that we actually wrote and fortunate to see introduced this year. And then just what Jody just mentioned, we also are part of that effort for cities and counties to pass Medicare for All resolutions. So actually, for example, all of these cities across the country already passed Medicare for All resolutions, including, for example, the city of St. Petersburg, the city of Tampa, all these other cities here, like highlighted in red in Florida, were part of this. And yeah, this is what it looks like. For example, here we have this was up in Gainesville, activists speaking for the city commission, asking them to pass Medicare for All resolution, which they actually ended up doing unanimously. So yeah, you can see on the right all of these cities in Florida that passed Medicare for All resolutions already. And it's the final thing that we briefly always want to mention is there's also an opportunity for candidates and elected officials at all levels of government to help by signing this pledge for healthcare called Patients Over Profits Pledge. So this is actually modeled after a different pledge on the issue of climate, the No Fossil Fuel Money pledge, and that pledge was that elected officials and candidates, they pledged to not accept money from the fossil fuel industry, which was an amazing success. There were more than 4,000 candidates, elected officials who signed on to their pledge, including our former vice president and president. So basically modeling it after that, there's National Nurses United, it's the largest union of nurses in the country with 200,000 members, and they came out with this Patients Over Profits pledge, where elected officials and candidates say we're not going to accept money from these for-profit insurance companies, or from big pharma, or from for-profit hospitals. And so in Florida, for example, we're very happy that State Representative Kamani already, for example, signed on to the Patients Over Profits pledge. Like there were like a variety of candidates, yes, all across the state who already participated and signed that pledge. So this is also like another opportunity. So if, for example, there might be candidates, elected officials here in this area that you might know that might be inclined to support such a pledge, then yes, please don't hesitate to let us know. So, yeah, finally, just kind of to give an overview of our upcoming activities. We do have a table coming up here on May 31st, which I know that's the day of picking. So we're gonna be Civic Pride. And then just like Joey already mentioned that, we're also gonna be at St. Street Pride, on June 28th. Elections consecutive by today, Medicaid expansion petition, as well as the fall petition. And, yeah, finally, then this, Wednesday, so 8 days from today, next Wednesday, actually, we're gonna be fortunate for a virtual monthly meeting, so these are on Zoom and we join from anywhere. We're gonna have State Representative Anna Eskamani who co-introduced these two bills, the Healthy Florida Act for Universal Health Care, and the things within that bill that we wrote to join us for a virtual meeting, and kind of give a recap about the legislative session as well as like what we can do and help like on the issue of healthcare. So thank you so much.
Thank you.
It's okay. How does the new law that they passed in Tallahassee affect this effort?
Petitions?
Yeah.
Yes, so unfortunately, there was a law passed in Tallahassee that puts new rules into place that basically makes it more burdensome to get constitutional amendment actually on the ballot. So yeah, the most changes they kick in for July 1st, as far as I'm told. So right now, the only things that we are restricted in immediately is we couldn't help anybody with like filling out some form, like say if it's the county or whatever information, everything has to be filled out by the person who's signing. And but not this month on June 21st, but the month after on so not May 21st, but on June 18th, the month after for Medicare for Florida monthly meeting, we're actually going to have Florida Decides Healthcare, the organization that's running this petition drive, as guest speakers, and they're going to give us all the details about the new law and what we can and cannot do.
Hi, thank you. First of all, I'd like to share experience that I had. I just got back from DC talking to your representative, which was very receptive. But I also talked to Rick Scott's office, Ashley Moody's office. Neither one of those were very, receptive. The one from Rick Scott didn't even act like, and he just didn't respond. At the end, I asked him, "You have any questions of us?" But nothing. So, but we also met with Vern Buchanan, who wasn't too bad, and Bill Arrakis. And those two weren't too bad, but yours was the best. They really are into the, but we were there to extend the Medicaid, trying to,
Look back against it. Months.
Plus also, I don't know if anybody knows it, but, if you want to donate your kidney to someone, you're, penalized in a lot of ways. One way is the insurance company may say, "We're dropping you because of this." And also the fact you might get fired because now you're may not be a productive employee. So that was the other part that we were doing, is trying to get that people were more receptive to, because that's just going to be tagged on to the FMLA, so the protection for these people. But anyway, I was up there for 3 days talking to these people.
Yeah, that's amazing. Thank you so much. That really, I think, makes a difference directly, visiting our legislators and speaking with them. Oh, yeah, thank you. Thank you.
But if anyone is curious to know about how difficult it would be to get this passed, I look at the amount of money the insurance companies spend on also look at the names of representatives and see how much they are getting. It's a massive amount of money. Not to mention if you watch television at night, count the number of pharmaceuticals you see in there, and think about how much those commercials cost during prime time. So this is a tough balance. It's one that can be won, but will only be won for what we're doing here. Everybody getting together and demanding it, not asking for it and not signing any petitions. Demanding it.
Real quick, while we're here, we've got Dr. Neil Manamala, who's actually a doctor here in Brandon. Do you have any thoughts on what you just heard?
Absolutely. Thank you guys so much for the talk. I mean, I'm gonna tell you this, you got so many middlemen and middlewomen in between the insurance companies, and it just goes to show how, in so many ways our society has degraded, right? And you got the insurance companies coming in the way, profits over people, you got big corporations getting in the way, but healthcare workers, we as physicians, nurses, and whatnot, we're in solidarity, right? And we want to do everything we can to fight these battles. And as much as yes, society is degraded in some ways because some of these spaces have been left open for insurance companies to kind of fill in, we have the power to make the change happen. We really do. As much as the powers that be want to make it seem like we don't have power, we have all the power, right? This is our country. As I applaud you guys fighting these fights federally, but it's a good reminder here that statewide change can happen, countywide and citywide change can happen. We are blessed here in Hillsborough County to have the Hillsborough County Healthcare Plan, which fills in where Medicaid has unwound and is able to kind of provide care where care is needed. Because ultimately, as much as we talk about the statistics and the data and the numbers, and those are things that are extremely important. I'm a person of science. I respond to that. Moving folks by the heart is really what it takes. And I do believe, we can shift more of those Republicans, more of those NPAs to ultimately recognize that these are questions of dignity, right? And so thank you guys so much. And, I'll keep coming out here. So thank you.
Thank you, Dr. Neal.
Does anybody else have any questions? All right, one thing that I'll just throw in that. So before I lived here in Florida, I lived in Costa Rica for 4 years. Costa Rica has a universal healthcare system. So I get to see what something like this would be like in practice, right? And one of the things that we frequently hear are like the horror stories of like, oh, you'll never be seen by a doctor or any of that. I will tell you based on my experience, that is complete and utter false. So for example, my friend's mom had breast cancer, double mastectomy, chemotherapy, reconstructive surgery, the full 9 yards. The entire cost for her was under $10,000. Right now, I know someone who went through that same circumstance, fully insured here in the United States, over $100,000 out of pocket. So from a cost standpoint, it's like not even a comparison. Just as another as a dad of 4, I will tell you. When so I founded a company here in Florida specifically to get health insurance. And one of the things that I thought would be great is like, hey, my daughter's going to need braces. Braces here were going to be almost $5,000. In Costa Rica, we started her braces. How much do you think it costs? $50. It cost $50 to get her braces put on in Costa Rica. So from a cost standpoint, it's like not even close. From a treatment standpoint, it's also not even close. So let me give you an example. My son was sick. We brought him to the doctor in Costa Rica. He was seen by the doctor, got a prescription. It ended up not working. We came back about a week later, and when we came in, we're like, hey, we're here to follow up with my son. I would assume there's, an amount to pay for this. I'm like, oh, no. This is the same thing. You come in for free for as many visits as you need because we already saw you, right? And so when you look at these things where you see in other countries, people getting that level of care, it's because you can come back and ask the doctor more questions and it doesn't cost you an arm and a leg. One last element on that. When it comes to things like COVID or other huge, infectious sets of diseases, like bird flu or anything else that's coming down the pipe. When we look at those types of things, we tend to think about it for how we experienced it here. So I was in Costa Rica when COVID happened. And one of the things about a healthcare system like this is guess what they have better than we do? Data. They have data on everybody because it's a unified reporting system. And so, for example, when travel restrictions were lifted, and we were able to fly back to the United States, we were able to see there hadn't been a single diagnosed case of COVID within 30 minutes of where we live. Which is crazy. And the entirety of the bulk of what we would call the COVID period, there were maybe less than 10,000 deaths in the entire country of Costa Rica. That's like 2 bad days here in Florida, right?
Yep.
During that time period. And a big chunk of that is because they could tighten or lift restrictions in areas because they knew where the infection was, because they had a unified reporting system. As we look at pandemics spreading and becoming more common, that's something that I think is gonna help. So just as somebody who has lived under a system like this, I will tell you, as someone who grew up on a farm in rural West Central Illinois, I heard all the horror stories like what a payer system like this would be from all my, now Trump supporting Republican family, right? Like, you'll never see a doctor, like you'll get pushed to the back. Like, none of that stuff was true. I had a fantastic experience actually living it. So I will tell you, if you never experienced it, it's substantially better than what we deal with here.
I had a former neighbor that he had to have a quadruple bypass, heart bypass. So he priced around, at the general wanted 160,000 just to walk in the door. He priced it in Thailand, 12,000. And the doctor was educated here, trained at school in the state here, and it included 6 weeks of rehab, where he could stay and they were watching him and taking care of him for 6 weeks after the surgery complete, 12,000.
So, and when you think about that, think about the commonalities that you just heard there. 6 weeks of ongoing care, or like for me with my son, came back in, oh, no, that's for the same thing. Keep coming until we get it right. When you talk to doctors, every doctor I've ever talked to about this, they just want to treat their patients.
Yes.
They're not the hindrance here. They're not the problem. It's all of the for-profit people who are the middle people between our doctors and between us. That's the challenge. And so something like this is something that we should be thinking about, because I can tell you from personal experience and from just talking to people who are in healthcare, my sisters are nurses. Her brothers, all of her brothers are married to nurses. So there's a lot of nurses in the family. All they want to do is take care of people, and most of this stuff is just a hindrance to them getting to do their jobs.
So how do you know?
Second.
Real quick, we've been talking physical healthcare, but this applies to mental healthcare too. As a licensed clinical social worker, if someone goes to a therapist in January, gets a full assessment done, and begins receiving services, and for whatever reason that doesn't work out, they only get one assessment per calendar year. So then if they decide to switch to a new therapist or new provider, I can't bill for an assessment if they want to come see me, or if I want to send them out to somebody else because maybe I'm not equipped for whatever diagnosis that they have. So you get one assessment per calendar year. That's it. From a mental health perspective.
So you can't get a second opinion.
Not till the next calendar year, unless you pay a deposit.
How would that work? I'm originally from the Netherlands, and what they do there, when it comes to healthcare, you pay into it every time when you get your paycheck, you pay into the healthcare system. So when something happens to you, you go to the doctor and that's it. And sometimes if you spend a long time in the hospital, you pay a little bit. If you, like one time I spent 7 weeks in the hospital, I had to pay a little money. That was really not that much. But how would that go? Is it basically the same system, the same way? Or you pay into?
I think, tell me if I'm wrong, the 2 actual experts in the room, but it looked like from your slides, the proposal is effectively to have withholding from your check in the form of increased withholdings for Medicare. And that will pay in, but that increased withholding would be cheaper than what we're already paying for insurance and co-pays and all things. So we actually pay less money,
Yeah.
because what we're doing is just like how a union is stronger together.
Right.
We are pooling our money and saying, hey, putting all this money towards healthcare, we're gonna allocate it where we need to. And yeah, you're gonna pay a little bit more towards Medicare technically, but overall you will pay less because you don't have to pay $3,000 a month to provide health insurance for you.
Yeah, so basically, because I guess
Yep.
some of them I just want to make sure I understood that right.
Did I get that right? You feel good? Okay. What other questions do we have? Anybody? Yes.
If you have, the petitions we're collecting right here.
All right, so if you signed a petition, let's make sure to get it back to them. If you haven't signed it, and now that you've heard what this is about, and you'd like to sign, let's make sure we do that before we get out of here. So, last note, we've got the picnic coming up, May 31st. Let's make sure that we're all there, that we all bring a friend, coolers and side dishes and chairs,
Got it.
okay?
And not coleslaw.
All right. Perfect. We will-
Only one person will call, so.
You've got the consent. You said it.
All right. Thank you, everybody, and thank you, Chris,
Thank you.
taking over and running my stead while I was down sick for 2 weeks. So, thank you, everybody. We'll see you next month.
We need the treasurer's report.
Oh, I'm sorry, yeah. Treasurer, real quick, treasurer's report, well, it was looking up
Just under $1,100.
There,
just under $1,100.
Broward County School,
Do we need meeting minutes to be,
legality,
accepted?
my friend from
Yeah,
her
okay.
son Joe.
Can we have a motion to adjourn?
Motion to adjourn.
Can we have a second? There we go. All right, thanks, everybody.
Well, I think I went to US Senator, and it was Democrat, and then I came here and I didn't like.
Oh, yeah, I won't leave it.
Thank you so much.
When I moved down, that was.